Here at our Grand Strand campus at the Health Education Center, students in the pharmacy program are learning what goes into magic mouthwash. Check this out. We found these students engrossed in pharmacy professor Tom Flinch's demonstration.
Powder left on the bottom, okay? It's all gone into the Benadryl elixir. And we do this for about a minute to make sure that we give it enough time to totally dissolve. And the reason we only start off with 20 mils is because the action of doing this mixing, you can imagine if we would have used 100 or more mLs of this Benadryl, we'd have this flowing out all over the place. But when we have a very small amount, like 20 mils is just a little bit more than a tablespoon. Chances are we're not going to make a mess out of what we're doing, and we're still going to come out with the same thing that we wanted to.
After he completes his instructions, some students will be asked to fill the magic mouthwash prescription, while other members of the class will have the opportunity to observe and ask questions.
Yeah, well, this is your first.
You put that in there.
8.
So while Christy's getting those ready, somebody can be measuring out.
And what was this again? The
That's the
Benadryl. And then
that's
this was
going to be
the
your solution that you start mixing the tetracycline.
20.
Get a little bit out of that.
There's a lot, a little bit.
To empty those capsules into what Christy's holding, and then drop the capsule into it.
Yeah.
Then
So
you
then I
almost got to start over.
Yeah, you poured it.
So.
Do you mix it?
I asked Professor Flinch to explain the differences between a pharmacist and a pharmacy technician.
The most obvious difference is the amount of education that's needed. The pharmacist goes to an accredited college of pharmacy for 6 years, and the entry-level degree is a doctorate in pharmacy. The pharmacy technician now goes to a technical college for a 1-year program and comes out as a pharmacy technician. The differences between what they can do at work are very, very small. The pharmacist is the person who has to do all patient counseling and has to make the decisions that take responsibility for the action. So in other words, a technician is not able to talk to a doctor's office and recommend to them any sort of therapy. That has to be up to the pharmacist. The pharmacist is also the one person who is totally responsible for everything that happens in the pharmacy. So that's why they carry their insurance, and technicians generally on the job do not have to worry about carrying insurance because they don't have to worry about making any final decisions on medication therapy. Other than that, they interview patients for histories. They enter all the prescriptions into the computer. They retrieve all the medications from the shelves and count the medications, put them in the containers, label them, and get them ready to be checked by a pharmacist.
One of the most important courses in their curriculum is pharmacy math, and counting is just the beginning.
The first semester we have an introduction to the world of pharmacy, and we have pharmacy math. Math is extremely important because everything that we do revolves around household measures and the metric system. Then in the second semester we have pharmacy practice, which goes into the specifics about working in retail and working in hospital pharmacy as a technician, and the first half of the therapeutics course, which is also known as pharmacology. Then the third semester, the only class that we have that they have to come to Horry Georgetown for is the second half of pharmacology. Then in pharmacology, what we teach is how the drugs act in the body as well as the organ systems that they work with. We'd like to have our technicians have a general idea about how all of these things work and where they work in the body, because with that kind of knowledge it helps them do a much better job of interviewing the patient for histories, as well as taking a look at their prescriptions when they receive them and know if there are any special things that have to be brought up with that patient when the pharmacist is going to counsel them.
Between the required clinical and retail rotations, they get plenty of practice before going out to interview for full-time jobs.
The student will go to one retail location in the spring semester, and in the summer semester they'll go to a retail location and a hospital. So they have quite a bit of time involved in the summertime with their clinical rotations, but they will get 3 opportunities to learn everything that they can prior to actually going out and interviewing for their full-time job. We have a large number of retail pharmacies in Horry Georgetown counties that we work with, and many of the large national chains sign an overall blanket agreement with us, and then the student can choose any one of those locations. We also work with several independent pharmacies. And then for the hospitals, unfortunately, this area of South Carolina is at a premium for the number of hospitals. We have 6 hospitals in the Horry, Georgetown area that we work with. And it's quite a challenge to be able to figure out how to get all of our students into the hospitals during the summer semester.
For Techknow, I'm Todd Cartner.